1. Which of the following best describes the main goal of the GAMSAT for medical school admissions? A. To assess rote memorization of medical facts. B. To evaluate critical thinking and problem-solving skills. C. To measure prior medical knowledge. D. To test familiarity with university-level biology. 2. When mentoring a student preparing for the GAMSAT, what is the most effective approach to encourage independent learning? A. Providing answers to practice questions. B. Assigning memorization tasks. C. Facilitating reflective discussions about reasoning processes. D. Repeating information until recalled correctly. 3. Which learning principle is most applicable when guiding candidates to develop long-term retention of GAMSAT material? A. Passive reading. B. Distributed practice. C. Cramming sessions. D. Constant repetition without feedback. 4. In GAMSAT Section 1, students are asked to interpret passages. This primarily evaluates which adult learning skill? A. Critical comprehension and inference. B. Short-term recall. C. Numerical calculation. Diagram memorization. 5. When designing a GAMSAT study program, the curriculum should focus on A. Facts alone. B. Analytical reasoning and interpretation. C. Technical memorization of formulas. D. Subjective guessing strategies. 6. Effective communication during GAMSAT preparation involves A. Giving orders without explanation. B. Encouraging open-ended questioning. C. Avoiding discussions to prevent confusion. D. Providing strict written instructions only. 7. An adult learner struggling with scientific reasoning benefits most from A. A structured explanation linking theory to context. B. Memorization of definitions. C. Avoidance of challenging questions. D. Reducing feedback sessions. 8. A mentor guiding GAMSAT candidates should prioritize offering one correct method only. B. Encouraging diverse perspectives. C. Punishing errors strictly. D. Limiting practice questions. 9. Which assessment method aligns best with GAMSAT-style reasoning evaluation? A. Multiple choice recall. B. Scenario-based reasoning tasks. C. True or false quizzes. D. Matching definitions. 10. When evaluating GAMSAT study outcomes, which metric best reflects learning improvement? Total study time. B. Changes in critical reasoning accuracy. C. Number of textbooks read. D. Frequency of rest breaks. 11. Adult learning theory emphasizes that learners are A. Dependent on instructors. B. Self-directed and goal-oriented. C. Motivated mainly by punishment. D. Uninterested in relevance. 12. In regulatory compliance for test preparation, an instructor must ensure A. Unauthorized materials are distributed freely. B. All materials respect intellectual property laws. C. Practice exams are copied from others. D. Content is shared without citations. 13. Feedback that strengthens GAMSAT preparation should be A. Immediate, constructive, and specific. B. Delayed and generalized. C. Emotional and subjective. D. Avoided to reduce anxiety. 14. Curriculum development for GAMSAT should include A. Learning outcomes aligned with test competencies. B. Randomized topics with no structure. C. Isolated lessons without integration. D. Ignoring measurable objectives. 15. Mentoring a learner who consistently fails verbal reasoning tasks requires reinforcement through peer discussion and modeling. B. Ignoring weaknesses to boost confidence. C. Increasing test pressure. D. Eliminating group activities. 16. Which evaluation technique best identifies a candidate's readiness for the GAMSAT? A. Summative assessment. B. Diagnostic assessment. C. Unstructured conversation. D. Peer grading only. 17. When a mentor asks the student to explain their reasoning aloud, this technique is known as A. Think aloud strategy. B. Passive learning. Content repetition. D. Silent review. 18. GAMSAT candidates who engage in metacognitive reflection. A. Understand their own thought processes. B. Depend entirely on external feedback. C. Avoid complex reasoning. D. Focus solely on test timing. 19. The ethical responsibility of a GAMSAT instructor includes A. Maintaining confidentiality and fairness. B. Promoting favoritism. C. Sharing students' scores publicly. D. Ignoring privacy policies. 20. Curriculum alignment ensures A. Teaching methods match learning objectives. B. Content is disconnected from evaluation. C. Assessment ignores instructional goals. D. Syllabus remains unchanged. 21. When preparing learners for essay tasks, mentors should emphasize logical argumentation and coherence. B. Excessive memorization. C. Length over quality. D. Grammatical perfection only. 22. Effective feedback for adult learners should A. Promote autonomy and reflection. B. Discourage questioning. C. Focus solely on grades. D. Avoid self-assessment. 23. A student demonstrating high intrinsic motivation in GAMSAT prep likely A. Studies for personal achievement. B. Needs constant external rewards. C. Avoids independent study. D. Prefers spoon-fed instruction. 24. Which regulatory standard is relevant for educational test preparation institutions? A. Data protection and privacy compliance. B. Ignoring copyright laws. C. Unsupervised dissemination of exams. D. Reproduction without permission. 25. When a learner applies knowledge to new problems, this demonstrates A. Transfer of learning. B. Surface learning. Isolated memorization. Linear recall. 26. A formative assessment in GAMSAT preparation aims to A. Improve learning through continuous feedback. B. Assign final grades. C. Replace all practice questions. D. Reduce mentor involvement. 27. Adult learners differ from younger students because they A. Seek practical applications of knowledge. B. Learn only for fun. C. Ignore outcomes. Avoid responsibility. 28. When managing study groups, the mentor's role is to A. Facilitate collaborative dialogue. B. Control all interactions. C. Provide minimal feedback. D. Avoid conflict resolution. 29. The purpose of reflective journaling in GAMSAT prep is to A. Track progress and self-awareness. B. Replace all testing. C. Criticize instructors. Focus on grammar. 30. An effective study schedule for adult learners should A. Include regular self-evaluation points. B. Focus on one topic forever. C. Be unstructured. Ignore rest periods. 31. Constructive alignment in curriculum design ensures A. Learning activities, outcomes, and assessment align. Only tests are emphasized. Teaching is unrelated to goals. D. Outcomes remain vague. 32. During peer mentoring, the best approach to conflict is A. Encouraging open communication. B. Ignoring disagreements. C. Imposing authority. D. Avoiding group feedback. 33. A student's ability to adapt to different question types demonstrates A. Cognitive flexibility. B. Repetitive learning. C. Surface memorization. Mental fatigue. 34. Regulatory compliance for exam preparation companies should include A. Data security and student record protection. Sharing confidential data. C. Ignoring plagiarism policies. D. Dismissing ethical codes. 35. When assessing written reasoning, a rubric helps A. Standardize grading criteria. Add subjectivity. C. Increase inconsistency. Reduce transparency. 36. Adult learners who are encouraged to teach peers gain A. Deeper understanding through articulation. B. Minimal engagement. C. Reduced motivation. D. Lower comprehension. 37. The most effective mentoring feedback focuses on A. Process and strategies. Personality traits. C. Punishment for mistakes. D. Ignoring progress. 38. Encouraging learners to link GAMSAT topics to life experiences applies A. Experiential learning theory. Behaviorism. C. Punishment reinforcement. D. Rote learning. 39. The GAMSAT evaluates higher-order thinking as defined by A. Bloom's taxonomy. B. Pavlovian theory. C. Maslow's hierarchy. D. Gestalt principles. 40. When a mentor models reasoning strategies aloud, this is A. Cognitive apprenticeship. B. Direct instruction only. C. Lecture-based method. Minimal guidance. 41. The inclusion of ethical case studies in GAMSAT preparation strengthens A. Moral reasoning and empathy. Memorization. D. Time management only. 42. Candidates who analyze errors after mock exams demonstrate A. Reflective practice. B. Avoidance behavior. Overconfidence. Superficial study.